During the 2010 legislative session, the state faced some serious economic challenges and significant budget deficits. Despite these challenges, eldercare services fared quite well, thanks in large part to Senator Don Gaetz' efforts. Senator Gaetz has a history of being an advocate of eldercare issues and was recently recognized for his advocacy as the recipient of the Florida Council on Aging's 2010 Legislative Advocacy Award. Thank you for being here.
Thank you very much for having me. I appreciate the chance to be on with you.
Well, congratulations again on the award, and I know John Clark is looking forward to presenting that award to you on behalf of the Florida Council on Aging at our October board meeting. So congratulations again for that.
Absolutely. Apparently the standards were lowered this year for who ought to be the Legislator of the Year, but I'm delighted. Elder services and advocacy for those services that help our older citizens has been an important part of my life. It's an important part of my legislative agenda. So I'm happy to join John and my other friends on the Council on Aging, and the award will mean a lot to me.
Well, very well deserved. Well, services for the elderly did come out quite well during the last legislative session. Why do you think that legislators were so supportive of home and community-based services? Well,
I think for one reason, they cost less money. Obviously, as you pointed out in your lead-in, we have severe budget problems right now. The state economist, Amy Baker, has said that for the next 5 years, the known resources coming into the state treasury will be insufficient to meet the critical needs of the state of Florida. So that means that you have to make tough choices. Well, the services provided by the Council on Aging are a less expensive and, frankly, a more attractive alternative than many of the other more restrictive services that elder patients and elder residents might have to take advantage of in the absence of the Council on Aging.
Well, you know, everybody talks about the tremendous fiscal impact of Medicaid on the budget and how that all works together. So how does the community-based programs and services kind of fit into that and help in the long run decrease these costs?
Well, you're exactly right. Medicaid has become, if you'll pardon the expression, metastatic. Medicaid now takes up twice as many dollars in the state budget as it did only 10 years ago. Multiples more money being spent on Medicaid than the number of additional Medicaid recipients coming into the system. And so, you know, basically that'll break the bank. That squeezes out money for education, for roads, for public safety, for everything else, unless we can get a handle on it. And in Medicaid, the federal government sets the rules and the state of Florida gets the bill. So we have to look for alternatives. If our only objective, if our only motive was financial, we'd be strongly supportive of community care for the elderly and waiver services and the kinds of services provided by the Council on Aging because they cost less.
Yeah, and I think a lot of people, or many people, may feel that they have planned adequately for the future, but with the cost of nursing home care, a lot of people may be on Medicaid at some point that didn't think they were going to be there. Don't you agree? Or,
well, I would agree with that, sure.
If we can keep them in their own homes as long as possible, it's much cheaper, which basically benefits the taxpayer. Am I correct?
It does, and I've spent about 25 years of my life in developing and delivering hospice care to terminally ill patients and their families. And one of the things that I've learned in developing and operating hospice programs is that people want to spend as much time as possible in their own homes, in comfortable and familiar surroundings, with their own families, if they can. But the if they can is the hardest part of that equation. And so if we don't provide the support services at home, then an individual who's elderly, who's frail, who becomes more dependent, and certainly somebody who becomes terminally ill has no alternative but to go into a more institutionally intensive and expensive setting. But as I said, if our only motive was financial, we would support community care for the elderly and the services provided by the Council on Aging. But if our motive is to make sure that people can do what they really want to do with the rest of their lives, which is what I think is even more important than dollar savings, then we ought to do everything we can to make sure people can stay at home. And you're right when you say that, you know, we all make plans and think that we're going to be good financially, But imagine, people who had savings, who were in the stock market, who had 401ks, who had annuity programs of one kind or another, and the meltdown of the stock market in 2008 and in 2009 left a lot of people with a fraction of the nest egg they thought they were going to have. And so that's why the services of the Council on Aging are so important.
Well, there was a recent report by the Office of Program Policy Analysts and Government Accountability that seemed to support all this. What do you think the legislative groups will be addressing this in the future, in the next year?
Look, we have to get our arms around the rising cost of Medicaid. We absolutely have to, because otherwise it will crowd out everything else in the budget. And one thing about Medicaid is that patients don't like it, providers don't like it, and taxpayers don't like it. It's a system that costs us over $30 billion a year, and nobody seems to think it's doing a very good job. So we have to look for alternatives to the usual system where we sort of slice and dice somebody up and we say, well, the doctor's going to provide this kind of care, and the nursing home and the hospital and the hospice and the home health agency and the Council on Aging and everybody else, but nobody's going to take responsibility for all the care and services. We have to get to a place, and I think we will in this state, where there will be a cooperative entity that will take responsibility for all the care and services of a person in the last years of life, so that we can control costs, so we can control quality, and so we can get the kind of results that we're looking for. I think that's where legislative policy is headed.
Well, and I know a lot of people want to take an active role. I know you have a reputation of being very open to hearing from constituents. Why do you think listening to these people and having these kind of dialogue with them are so important?
Well, as my mother often reminded me, she said, I'm old, but I'm not stupid. I know what I want. I know what my preferences are. I'm independent, and I like to have my needs respected and my wants respected. I think it's important to listen to people who, first of all, have had the experience of life that, some of us have had a portion of, but we haven't had all of. But the other thing is they really understand. I think our elderly folks are the best judges of the quality of services that they get. They're customers. So they know that the Council on Aging does a good job. They know, who does a marginal job. They know who does a poor job. And I think as the senator for Northwest Florida, it's important for me to listen to the customers and then fashion legislative policy around customer needs and customer wants, and in this case, therefore, make aging services more customer friendly.
Well, once citizens have read or researched the issue, how should they go about contacting someone? How do they best initiate their dialogue with someone like yourself?
I'll tell you, the best thing for me as a senator is when I get a chance to go out and knock on people's doors. I do that all the time. I guess I've knocked on about 30,000 doors, and not running for election necessarily, but after elections are over. We do neighborhood days in the Pensacola area. Every once in a while we do a different neighborhood every month. So we set up an office in a church. We invite people to come in and share their stories and let us know face to face if they have any problems. But if you want to contact me directly, just go to Gaetz, Gaetz, .don.web, W-E-B, at flsenate.gov, or write me at Box 1234, Niceville, Florida, 32578. I read every email, I answer every letter, and I want to meet with people and understand what their needs are. Then I can be a better senator.
Great information. We're short of time, and there's so much we could talk about, but we really appreciate you being here, and congratulations again on the award.
Thank you so much.
Thank you.